Many men remain unaware that their penis undergoes aging, much like their heart, brain, or bones do. Disregard it, and you risk more than just losing functionality. One finds oneself stripped of confidence, dignity, and the bonds that once tethered them to others. Greetings, I am Dr. Michael Harrison. As a urologist and professor of medicine, I bring over 3 decades of expertise in men's health, focusing on assisting older men in maintaining not only their sexual function, but also their sense of identity. Imagine if I revealed that the primary reason for penile dysfunction in men over 60 is not age-related at all, and that a straightforward daily routine, rather than medication, could transform the situation entirely. In this video, I will present 5 crucial methods for maintaining the health of your penis, supported by scientific evidence and specifically designed for men over 60. These aren't mere gimmicks. These are tangible, actionable approaches that can preserve your well-being and enhance your quality of life. Be sure to accompany me until the very end, as I will unveil a crucial bonus tip that many physicians overlook, yet it holds the potential to avert one of the most distressing penile conditions commonly encountered in older men. Before we dive in, if you haven't subscribed yet, now's the perfect time to click that button. Activate the notification bell to ensure you never overlook tailored, age-appropriate health insights crafted specifically for you. If this topic strikes a chord with you, please share your thoughts by typing 1 in the comments. If you believe there are areas where I could enhance my explanations or provide greater clarity, please indicate by typing 0. Your insights enable me to enhance my service to you. Let us embark on a journey through the initial and arguably the most misconstrued aspect of nurturing your penis as the years unfold: the importance of maintaining its vitality. For the reality is, once you cease its use, your body begins to forfeit it. 1. Maintain a vibrant sexual life, even in the absence of intercourse. In conversations with men in their 60s and older, I often encounter a prevalent misconception. It seems my romantic endeavors have come to an end. A quiet acceptance has settled over many, as they resign themselves to the notion that sexual function inevitably diminishes with age, feeling powerless to alter this course. Allow me to share something of significance with you. This belief is not only false, it can indeed serve as the very catalyst for a decline in function. Your penis, much like your muscles, heart, or brain, requires regular use to maintain its health. During prolonged inactivity, blood circulation diminishes, elasticity diminishes, and tissues may start to waste away. That isn't a method of instilling fear. It is fundamental physiology. The phrase we employ is penile disuse atrophy. It is much more prevalent than many men understand. However, there is a silver lining. It is entirely within our power to prevent. Engaging in sexual activity, such as masturbation, transcends mere pleasure. The essence lies in safeguarding what we hold dear. By ensuring a steady flow of blood to the area, you are preserving the health of the tissue, the supply of oxygen, and its overall function. Consider it akin to elongating a muscle to prevent it from becoming rigid as time passes. And if engaging in intercourse or solo stimulation isn't feasible or comfortable at the moment, that's perfectly fine. Alternative approaches exist, such as employing a medically sanctioned vacuum erection device, or participating in pelvic floor exercises that enhance circulation and performance. What is of utmost importance is that you remain active. Your body reacts to activity, regardless of age. In addition to the tangible advantages, there exists another dimension that is equally vital: honor and selfhood. For numerous men, their perception of sexual vitality is intricately linked to their self-image. As that begins to fade, so too does the sense of confidence that once accompanied it. Yet, maintaining a vibrant sexual life, in whatever manner suits you, can aid in regaining not only performance, but also a sense of pride. It's not about embodying the person you were at 25. It revolves around maintaining a connection to your current self, embodying wisdom, experience, and intrinsic value as a man. I've witnessed men in their 70s reclaim their sexual health by taking this initial step. Frequently, when they achieve this, various aspects of their health start to enhance as well. It creates a chain reaction: assurance, closeness, inspiration, All threads intertwine. Having understood the significance of maintaining a vibrant sexual life, allow me to reveal something equally essential. It's a notion that every man believes he has mastered. Before the moment slips away, let us delve into the subject of hygiene. 2. Maintain cleanliness. The correct path. This may seem apparent. After 3 decades of working with men in my practice, I can confidently assert that proper penile hygiene stands out as one of the most neglected yet undeniably vital aspects of self-care. Particularly as we age, it is disheartening to witness numerous men enter my office burdened with infections, irritation, or even more grave ailments, all due to a lack of proper education on personal hygiene. It's not merely a matter of filth. It revolves around the uncertainty of how aging transforms your body and the necessary adjustments in your self-care to accommodate these changes. With the passage of time, our skin tends to grow increasingly delicate. The immune response diminishes, leaving the body less agile in combating bacteria or mending irritation. What once sufficed as adequate hygiene in your 30s or 40s may no longer meet the mark. If you have not undergone circumcision, this aspect takes on greater significance. The accumulation of bacteria, sweat, and dead skin beneath the foreskin can result in infections such as balanitis, as well as conditions that may elevate the risk of penile cancer. Indeed, cancer. It is far from uncommon. Brazil stands out with one of the highest incidences of penile cancer, primarily attributed to inadequate hygiene practices. The risk remains unyielding, even as the years pass by. It rises. Yet, the solution is straightforward. Cleanse delicately using warm water and a gentle, fragrance-free soap. Nothing severe. Gently retract the foreskin, ensuring a thorough rinse, and above all, make sure to dry completely. Moisture serves as a fertile environment for bacteria, particularly in the creases of the skin, making it essential to maintain cleanliness following intimate encounters. Vaginal fluids, lubricants, and even the natural sweat and oils of the body can disrupt the delicate equilibrium of healthy bacteria present on the skin. A mere minute is all it requires. Yet this simple daily ritual has the potential to shield you from distressing infections, unpleasant scents, or even graver concerns. What astonishes numerous men is the profound emotional transformation that accompanies this experience. Caring for your penis with the same attention you give to your teeth, heart, or overall appearance can transform the way you perceive yourself. Refined, self-assured, empowered. That sentiment holds significant weight, particularly in a society that frequently encourages older men to yield or abandon their physicality. Yet hygiene is merely the starting point. There exists a crucial truth, one that many men remain silent about until the repercussions have already taken their toll. It all begins with the moments of intimacy that unfold when one is not entirely prepared. Let us delve into a concealed peril that remains largely unspoken. 3. Refrain from engaging in sexual activity when the penis is only partially erect. This may catch you off guard, yet it's a phenomenon I've encountered all too frequently in my practice. Men may inadvertently harm themselves during intimacy, often due to a lack of awareness regarding the risks associated with engaging in sexual activity before achieving full erection. Though it might seem a trivial aspect, particularly when passion and the present moment take precedence, the act of attempting penetration with a semi-erect penis can inflict harm that accumulates over time, leading to potentially transformative consequences. Allow me to clarify. Your penis is more than merely a sheath of skin. Within, one finds a fragile architecture of blood vessels, soft tissue, and sleek muscle. In moments of lacking complete rigidity, it fails to possess the necessary support to endure the weight of pressure. Thus, compelling it to act prematurely may result in what we refer to as microtraumas. Minuscule internal wounds that might not elicit immediate discomfort, yet slowly give rise to scar tissue lurking beneath the surface. As time passes, this scarring may solidify and exert tension on the adjacent tissue, resulting in a condition referred to as Peyronie's disease. For those unfamiliar, this condition leads to a painful bending of the penis, at times to such an extent that engaging in intercourse can become challenging or even unfeasible. Many older men have found themselves sitting across from me, hesitant to voice the changes they've observed, often waiting until it's too late for conservative treatment. In reality, the majority were completely unaware that such a risk was even on the horizon. They were not acting with abandon. They were merely lacking in information. Therefore, I feel compelled to urge you at this moment, take a moment to slow down. Your well-being, your ease, and your self-assurance hinge upon the care and reverence you show towards your body. Ensuring you are fully erect before engaging in intercourse is not only a matter of safety, but also a wise choice. It safeguards you against lasting harm, ensuring that intimacy continues to be pleasurable and devoid of discomfort. Incorporate lubricants to ease friction, and savor the moments of foreplay or stimulation at a leisurely pace. Engage in a conversation with your partner if you sense an urgency to hasten things. The potential consequences are not worth it. Allow any medications or aids intended to assist with erections to take full effect before moving forward. This modest gesture of prudence has the potential to spare you countless years of unease and vexation. It's not a matter of fragility. It's a journey toward knowledge and strength. Having grasped the importance of safeguarding your body during intimacy, it is time to redirect our attention to an aspect that influences not only the physical form, but also the mind. It stands as one of the most significant concealed dangers to genuine connection and longing in later years. Let us delve into the unforeseen expenses associated with excessive consumption of pornography. Restrict indulgence in pornography. Enhance genuine connections. I wish to communicate candidly from one man to another. We exist in an era where the availability of adult material has reached unprecedented levels of ease. For numerous older men, particularly those who find themselves single, widowed, or experiencing a sense of disconnection, it may seem like a benign means to sustain their desire. After years of working with countless patients, I can share this insight with you. What begins as a mere respite can gradually transform into a substitute for something far more profound and satisfying. It has the power to strip away the connection you rightfully seek. Excessive consumption of pornography fundamentally alters the brain's response to arousal. It frequently conditions the mind to depend on a particular kind of stimulation, swift, visual, and solitary. As time passes, this phenomenon may result in what we refer to as desensitization, wherein genuine intimacy fails to evoke the same thrill it once did. Men in their 60s and 70s have expressed to me their feelings of confusion. They continue to harbor that longing, yet in the presence of a partner, their body fails to react as it once did, leading them to believe that something within them is irrevocably damaged. Yet in numerous instances, it transcends the physical realm. It stems from psychological conditioning brought about by excessive exposure to pornography. Moreover, an overindulgence in pornography can foster emotions of shame, isolation, and diminished self-esteem, particularly when it evolves into a solitary ritual that supplants genuine human connection. One begins to ponder the essence of their masculinity, the capacity to forge connections, and the worth they hold within a partnership. That is a significant burden to bear, particularly when one is already traversing the emotional complexities that often accompany the passage of time. I have no intention of casting judgment on anyone. No judgment exists here. However, I do advocate for a balanced approach. Employ it with caution, if you must. Concentrate on restoring your innate arousal pathways, utilizing memory, imagination, or genuine emotional closeness. It could involve savoring the moments of intimacy, engaging in candid conversations with your partner, or embracing the sensations without the weight of pressure or expectation. Desire remains undiminished by the passage of time. It simply requires a different form of focus. Restricting pornography does not equate to sacrificing enjoyment. It signifies taking it back in a manner that is more wholesome and significant. It revolves around restoring the balance between your body and mind, allowing you to encounter genuine connection rather than mere stimulation. In the spirit of harmony, there exists a final element to this intricate puzzle that unites all the pieces seamlessly. It serves as the bedrock that upholds not only your sexual well-being, but also your entire vitality. It fuels your self-assurance, enhances your capabilities, and enriches your experience of life to the fullest. Let us delve into the intricacies of lifestyle, 5. D. Emphasize lifestyle rather than medication. After years of working with men over 60, one undeniable truth has emerged for me. Your lifestyle profoundly influences your sexual health, surpassing the effects of any medication. A multitude of my patients arrive with the yearning for a miraculous solution, a swift remedy to restore what they believe has slipped away from them. Yet, the truth remains that no medication can rival the strength of steadfast, healthy habits. The way you live serves as the catalyst for every aspect of your being, influencing your circulation, hormonal balance, and cognitive clarity. Indeed, your capacity to thrive and reconnect with your true self once more. The link between lifestyle and sexual health transcends mere anecdote. It is rooted in biology. The occurrence of erections is intricately linked to the quality of blood circulation, which in turn relies on the vitality of your heart and blood vessels. Engaging in smoking, excessive drinking, or poor eating habits inflicts harm on your vessels, constraining circulation to the most essential areas of your body, including your penis. Erectile dysfunction frequently serves as an early indicator of heart disease, subtly signaling that there may be more significant issues at play within the body. Yet, there lies a silver lining. Each healthy decision you embrace today resonates with both immediate and enduring impact. Upon ceasing the habit of smoking, one can observe a remarkable enhancement in circulation within just a matter of days. Reducing your alcohol intake may lead to a rebalancing of testosterone levels. By dedicating just 30 minutes a day to walking or incorporating foods that promote vascular health, such as berries, leafy greens, and fatty fish, you are not merely prolonging your existence. You are enhancing the quality of your life. Your vitality resurges, your self-assurance strengthens, and gradually, purpose starts to take shape. What captivates me the most is witnessing a man come to the profound understanding that his body is not broken, but rather, it is responsive. It awaits his return, longing for the attention and affection it has bestowed upon him throughout the years. I've witnessed individuals transform their lives profoundly simply by altering their everyday habits. They enjoy a more restful slumber. They share more laughter. They reconnect with their partners and embrace life anew. And they cease their dependence on pills, having forged something far more resilient, a cornerstone. Before you consider another prescription, consider lacing up your walking shoes instead. Select water instead of whiskey. Embrace the importance of rest. Engage with those around you. Your body attunes itself to the rhythms of your life, not merely the substances you consume. At this juncture, I have one last nugget of wisdom to impart. It may appear straightforward, yet it possesses an unexpected strength. Yet, the majority of men remain blissfully unaware of its existence. It unfolds in the quiet embrace of slumber. It may very well be the crucial element in safeguarding your masculinity as the years go by. Let us delve into a topic that surprises and intrigues: the attire you choose, or choose not to choose, for slumber. Here's an additional insight. Embrace the freedom of slumber without the confines of underwear. This may appear to be a minor detail, perhaps too straightforward to hold significance, yet through the years, I've discovered that it is frequently the most subtle habits that yield the most astonishing effects. Slumbering sans undergarments is one of those practices. Once you grasp the reasons behind it, your perspective on nighttime comfort and long-term health will transform entirely. As you drift into slumber, your body embraces a profound phase of restoration and balance. For men, this journey encompasses the unexpected occurrences of spontaneous erections that take place during the night. It is a phenomenon that is entirely ordinary and, in fact, crucial for maintaining the vitality and oxygenation of the erectile tissue. However, donning tight or constrictive underwear, particularly briefs or fitted sleepwear, may inadvertently compress your penis during those nighttime erections. As time passes, such pressure may result in tissue irritation, diminished blood circulation, and in certain instances, the formation of internal scarring. The unnoticed scarring, especially when it lingers for years, can culminate in a condition known as Peyronie's disease, a painful curvature of the penis that is, surprisingly, much more prevalent among older men than many might assume. Opting to sleep in the nude or in loose-fitting boxers grants your body the liberty to rejuvenate itself organically, free from unwarranted friction or constriction. What might appear to be a minor change can, in reality, create a significant impact for men seeking to maintain comfort, functionality, and self-assurance. And if you find yourself pondering whether something so straightforward could truly make a difference, prepare yourself for the intriguing connections that will unfold among these habits. When they come together, a powerful transformation begins to unfold. In this concluding message, I aim to illustrate how these 5 vital steps, along with an additional habit, can assist you in regaining something far more significant than mere sexual health. Let us delve into the concepts of dignity, confidence, and the essence of aging gracefully on one's own terms. In conclusion, it is understandable that for numerous men, particularly as they enter their 60s and beyond, discussing sexual health may evoke feelings of discomfort or even seem superfluous. Yet, the reality is that your connection with your body persists beyond the passage of time. It transforms. The way you nurture it now holds greater significance than ever before. The topics we've explored today: ensuring your penis remains active, upholding proper hygiene, safeguarding yourself during intimate moments, moderating exposure to pornography, embracing a healthy lifestyle, and yes, even the practice of sleeping without underwear. These are not mere suggestions. These are subtle gestures of self-regard. Every element strengthens your sense of dignity, your vibrant essence, and your bond with your true self. I have had the honor of guiding numerous men on their journey to reclaim confidence in their bodies, not due to a pursuit of youth, but rather through a conscious decision to care, to remain involved, and to regard their sexual health as an integral aspect of their overall well-being. If you've been grappling in silence or feeling uncertain about how to begin, know that you are not alone. There's a silver lining. The opportunity for change is always within reach. Each day presents an opportunity to embrace a new approach, to select a more favorable option, and to take a stride toward regaining mastery over one's life. Your health may not determine your value, yet it undeniably mirrors the care you give it. When you nurture yourself through these straightforward yet impactful methods, the results are evident. In the manner of your stride, the connections you forge with those around you, and the emotions that dwell within. I appreciate your presence, your willingness to listen, and your decision to invest in your own growth. You have embarked on the initial journey. Let us continue onward, united in purpose. If this message resonated with you or brought someone to mind who could benefit from it, kindly consider liking this video and sharing it with a friend, brother, or father. Be sure to subscribe for more authentic discussions on men's health. Self-care should always be embraced without guilt, and it's never too late to begin.